Hi guys, here's Min Park. I put together this video to show you what changes is happening for Medicare 2026 and also Social Security income. So I create the video called Medicare 2026 Big Changes. So let's dive in. All right. So 2026 Medicare, this is a prediction. The reason being is that Medicare price and also Social Security income, so-called COLA, will going to be announced on October, middle of October or end of October. Right now is end of the September, so I do not know, but prediction will be pretty accurate. So you will be feel comfortable kind of around that range will be actual number. So the standard part B premium will going to be increased. Currently, 2025, our part B premium is 185 unless you pay ARMA, which is your higher income receiver. But other than that, the people usually pays for standard part B premium, which was 185 for this year, but it will increase for 206.50, which is 11 points up. And also part B deductible was 257 in 2025 and will be raised to 288, which is 12% is up. If your income is more than $109,000 as a single or 218 for couple, then you usually pay extra premium for your part B and part D. So this chart will show how much you might need to worry about. But the income will be maxed out for single for $500,000 or for couple $750,000 income, then you will pay the maximum. Pay $702.10 for premium, which is a part B premium with extra charge, which is a ARMA. Or if you have a part D separately, then whatever the part D premium you choose, you will going to pay that plus up to $91. Depends on your income bracket. So take a look at the chart here and then be able to tell how much you may need to pay extra. In 2026 Social Security benefit, COLA will be expected for 2.8 increase. The COLA is cost of living adjustment, right? So 2025 average beneficiary who receives Social Security income is about 1976 per month. So if it's going up 2.8%, then 2026 average income will be 2027 per month. So the problem that I see is that Part B premium went up 11%, which is almost 12, and Part B deductible also went up 12%. But the income, if you receive Social Security income, it's only raising up 2.8. So your money is not as value as much, things that going up the price. So that's kind of downside on that part. So what's going on in the Medicare? So you should receive this Medicare and 2026 brochure or booklet. If you wanted to see it online, I just including the address here so you can go there directly and be able to take a look at it. And why is it important to take a look at what changes every year with the Medicare and booklet? Is that it will show you what changes in Part A and B coverage. Also, might a lot of people say, hey, you know what? I don't have original Medicare. I actually switched to Advantage plan, so therefore I don't really care whether Medicare covers what Medicare covers or not. No, actually, that's not true. The Medicare only approved the Advantage plan, which always at least covers original Medicare benefit plus some, and that's what the Advantage plan has to be included. So it is very important to know that what's going on with the Medicare because it will affecting your Advantage plan as well. So that's something that you need to know. So what changes? The very first page shows what's new and important. Now we go by line by line so you understand what is going on. So first thing is that says cap what you pay for prescription drug. So 2025, which is this year, the Medicare basically put the cap for your Part D service cost to $2,000. But 2026, it went up $100 more. So next year, your maximum out-of-pocket expenses for Part D as a David will be $2,100. So what is this matter? These matter only mainly usually for people that who have a high cost brand name drugs, whether you were going to take those medication or you take it by shot. It doesn't really matter. Usually brand name, you need to pay deductible if there is a plan that pays the deductible on top of your co-insurance, and the maximum cost of 2026 will be $2,100. So those are people that who have a limited income that usually have an issue. Those people that who get expensive medication, tier 3 and up, they always ended up paying a lot of money beginning of the year. Like January, February, March, you may pay the deductible plus co-insurance that can be sometimes up to $500 plus. And there can be a lot of burden if you have a certain amount of money that you can spend every month. So what Medicare created, something called Medicare Prescription Payment Plan. This, you have to enroll to your insurance company. It's not automatic. You need to call to whatever Part D or Advantage company that you choose, and you call them directly. Say, hey, I heard there is a Medicare prescription payment plan. I would love to enroll it in. So what happened is these are not for the people that who only takes a genetic brand, because you only pay just a little bit. But people that who actually hitting those deductibles, that might be is a good idea to enroll it in, because what happened is that when you picking up the drug, after you enroll it in, you no longer pay your prescription price to the pharmacy. So what happened is that you're picking it up your medication directly without paying nothing, and you will pay monthly to the insurance company like a bill. So that's what's going to be happen. So you will going to have throughout the year, every year, you will going to have a certain amount of money, and then split it out throughout the year evenly, so that way you are not paying really high medication costs this month, and next month we're going to be dropped. That's not how it works. So you were going to have kind of evenly payment. That's what called Medicare Prescription Payment Plan. Okay. And also you may heard there's a lot of medication that the government is negotiating to reduce the price. There is a couple that you need to know. Medicare is able to negotiate directly with the manufacturer for the price, the certain high spending brand name, Medicare Part B and D drug that don't have a competition. So the lists are showing right here. Already 10 drugs, 2026 negotiated. A lot of famous diabetes medication is here. Eliquis, Jardiance, Zolto, Januvia, and things like that nature. 10 of them is listed right here. And 2027, there's a 15 drug that will going to be negotiated. Same thing, Ozempic, Wegovy, all the way down to Tesla. So if you actually taking any of these, hopefully we're going to have a much better price and be able to have a less cost will be something that we are hoping to see it. And also, you may heard it, you may enroll it in, but something called Extra Help. Extra Help is help people with a limited income, Medicare prescription drug program. This is not Medicaid. It's a separate program to reduce the cost for your prescription drug. It can help for premium, deductible, or co-insurance. Some may get all these benefits. Some may have little. Depends on what is your income. So it's a typically higher income limit than Medicaid. So if you're not quite sure, I always suggest to go and do it. And the worst case scenario, you were going to say no, and then you'll not be able to get it. But If you get accepted, then you most likely will going to have some sort of savings. So in order for you to enroll it in, there's a two-way. One, you can go online and then apply it online, which is socialsecurity.gov/Medicare and Part D extra help. Or you can call 1-800-772-1213 and then ask for I wanted to enroll in an extra help and then be able to help you. All right, so a lot of people have this question, how much do I pay for my prescription? My answer is cost will be varied by plan. So it is important to check your plans out every year to see if that plan fits the best for you. One, because every plan might have a different formulary. Formulary means that what kind of medication that Part D plan we're going to carry. Some have a wide variety of medication cabinets. Some may have a little. What I've seen so far, if they have a wide variety of the medication cabinet, usually monthly premium is higher. Or limited, obviously, will be very lower. So the lower premium ones might be fit good for people who don't really need that much expensive medication versus maybe some might have to pay a little bit more premium in order for them to reduce the price of those expensive drugs. So it depends on what it is. And also, the insurance company can decide which medication is which tier. So each medication have a tiers. Tier 1, which is preferred genetic, all the way to the specialty, which is tier 5. Obviously, going up the tiers will be higher costs. So tier 3 and up, you will going to pay deductible if that plan has a deductible. Most likely tier 1 and tier 2, which is a genetic brand, usually they don't have a deductible. So don't really need to worry about deductible part of it, but you may just pay a little bit copay. So those are things that you need to know when you pick your Part D plan. And also be aware which plan you choose, you may have to change your pharmacy where you pick up your prescription drug because each plan might have preferred network pharmacy or standard pharmacy. So if you pick the plan that, let's say CVS is preferred, then when you're picking up the drug from the CVS will be the lowest cost. Okay, some plan might be CVS is a standard network. Now you may pay more than preferred network pharmacy because CVS is not that preferred network. So when you change your medication plan, make sure what is a preferred pharmacy so that way you can reduce your cost of your drug. One thing though I really want you to know is that in some cases, if your drug is a higher tier and your prescriber think you need that particular drug because you maybe have a side effects, you can't really take the genetic brand and things like that, then you can ask that plan to have you exception to get lower co-insurance and co-pay for the drug in the higher tier. The reason being I say is because plan can change their tier drugs list at any time. So can you ask tier 5 to tier 1? No, that's not going to be happen. But you may get exception if you can involve with your provider. Let's say your doctor say, hey, you know what? This person needs this particular one. This particular brand because she has a huge side effect, there's nothing else that she can take or he can take or things like that nature, then the plan might give you exception to have that lower tier, especially those people that would take tier 3 drugs. That might be the benefit to have an exception because they usually reduce one tier down, which means you no longer will going to need a deductible. So if you take a tier 3 and then that's only brand name, then maybe it's a good idea to ask your doctor to see if they can involve to having this exception, write it down to the plan. So that way you can save some money. All right, number 2 changes. It says meeting your healthcare needs. Medicare now pays for advanced Advanced primary care management service each month, where your doctor or other healthcare provider coordinate the tailored care to your needs. Providers that offer this service may give you 24/7 access to your care team or provider and more. So this is something new. So the primary care, not all the primary care doctor will do that, but there is a primary doctor called Advanced Primary Care Management Service, and they can provide you ongoing support between visit, check on you, and then PCP help, all the coordination of everything. The reason this is it's important. Sometimes you goes to primary doctor, specialist, and then specialist and your primary doctor and everybody else writing different kind of prescription. Sometimes the medication kind of fight each other. It's not good for you. So there is a subtle issue in there. So they trying to limit that. So therefore, this primary care that who has advanced care management service, then they are the one that who coordinate everything. But the thing is, because this is the original Medicare that we're talking about, there is a copay and deductible maybe associated with it. They always need to get the consent. As you already know, the Medicare, we're going to pay monthly fees, and then you may have to pay copay and deductible. Make sure you don't want that services. Then when the doctor give you consent, hey, say, I don't want that. That's something that you need to worry about. If you have Plan G already, then, I guess you don't really need to worry about the cost, because most of the time, the Medigap G plan will going to be pay all those costs. But if you don't think that you need it, then, it's something that you need to think about. All right, so 2026 Medicare change number 3 is early detection matter. Medicare covers a wide range of colonoscopy screening, including CT colonography. So what this means is that Medicare pays screening every 10 years if you are normal. If you're a high-risk individual, then they will offer 24-month screening tests, right? They also offer CT colonography, which is if you're a high-risk person, then it's 24 months. If it's regular, 6 months, and things like that. So this is just something that you need to know. The screening will be paid 100% if it's every 10 years, right? But when you do that, while you do screening, if they find some polyps and if they snip those polyps out, then now you need to pay for Part B insurance, which is 20%, but not 20%, it's more like 15% for these procedures. Or if it is inpatient, then you may be paying a co-insurance for Part A as well. If you have Plan G, then you don't have to really worry about so much of it. But if you have high deductible Plan G, then you have to think about, okay, well, if I have a screening, if they cut those polyps out, then I may have some costs coming up. So that's something that you need to know. All right, number 4, help Medicare fight fraud and cut waste. Protect yourself from fraud and medical identity theft by checking your Medicare summary of notice. So Medicare summary of notice, we're going to show you what kind of benefit you took from that particular provider. Check it. See if all the services that you received is there. Is there any services that you didn't receive but still there? I hope that I can tell you, hey, you know what? There's always the honest people only lives in this world. Unfortunately, that is not the case. I seen some receipt showing that the clients didn't even had that services done, but somehow it's in the benefit. So which means those providers may sneak those in without the beneficiary know about, and Medicare pays for it, and then you ended up paying for whatever the cost you might be. So let's help the Medicare fight the fraud and cut waste. And if you want to call them up and then let them know, hey, you know what? I seen something that I don't aware that I received it, then call 1-800-633-4227 and let's help the Medicare fight the fraud and cut waste. All right, 2026 Medicare changes number 5 is the go digital with Medicare. What this means is the same exact thing. Let's help the Medicare cut the waste. Okay. So in order for you to receive the book or the letter, then obviously we have to print and then use a paper and all those things, right? If you want, you can go digital by going into Medicare.gov and then ask for Medicare.gov handle it and then be able to download it instead of having it at home. You can do that. And same thing with Medicare summary of notice. You can actually receiving electronically as well. So if you don't have any account yet with the Medicare.gov, you can create one going to Medicare.gov and then be able to do all that. And then all the good news is we're going to be there too, so why not? So I went over things that it changes on 2026 Medicare. I need your help in order for me to compare your plan and if your medication is best fit for you or not. I need update your information. I'm going to send you an email or text messages about updating your info so that way I can compare your plans if that is the best plan or not. If I believe that it doesn't need to change, then I will let you know that, hey, you know what? I think you're good to go. If you're happy with your plan, then you stay in where it is. If I believe that you need to change it and then be able to get the better benefit and otherwise, then I will let you know and then we're going to make an appointment and we'll go over more details. So please, when you receive your email or text messages, update your information. Please do so accordingly so that way I can do my best to help you. So if you have anyone in these states, 14 states right here, California, Arizona, Nevada, even Missouri now, I can help those people to enroll in Medicare or compare the plans. So if you know anybody, you can refer them. They can ask me any questions to askinsurancegal@gmail.com or they can go to check it out, my website, which is parkssam.net. They can call 928-493-2782. So hopefully I will be able to talk to you soon and I will let you know what's going on. Thank you for watching and have a great day.